My name is Paul Notar. I am the Senior Associate Director of International Admission at MCPHS, working in the admission office. A few quick things to note. Please keep your microphone muted throughout the webinar unless you are a panelist. Please type your questions in the Q&A section of your screen, and we will address as many as we can. And lastly, after the webinar, you will receive a recording as well as a survey. Please take time to answer the survey because your feedback is certainly valuable.
Hi, everyone. My name is Krista Levac. I'm the Associate Director of International Admission on the International Admission team with the university. My primary focus is working with our students applying from Canada, either international students in Canada or, of course, our Canadian citizens and permanent residents. I also have another role on our team in that I support the admission process for students applying to the 7-year BS-MD pathway program with St. George's University Medical School, which you're going to hear about in just a few minutes. So we have an incredible registration of participants for this webinar. We're really excited to be able to bring to you some things you should be thinking about when considering a university. We may have students on the webinar. We may have parents logging in to listen to what we have to share regarding next steps. But we know that there are participants from all over the world. You will hear throughout our presentation our use of the term international student. And for us, for our purposes for this webinar today, we're referring to students coming to the United States on a visa type, perhaps an F1 student visa or another visa type. We're not referring to US citizens and permanent residents. So MCPHS was founded 200 years ago. We are the oldest university in the city of Boston and originally founded as a school of pharmacy. And over the last number of decades, we've definitely expanded our portfolio of degree offerings. We now offer more than 100 academic programs in various sectors and paths for health, including healthcare practice, research, disease prevention, healthcare administration, technology, the business side of the healthcare industry, and of course, the life and biomedical sciences. We really are and have emerged to be one of the most important health science-focused universities in the entire world. So we're really pleased that you're here today, and I'll pass it back to Paul.
Thanks, Krista. So this is why, based on what Krista was saying, rooted in all this expertise, we have created a webinar series to assist students and prospective students who are contemplating a program in one of the wide variety of areas that we specialize in. So we realize that many of you are in the process of deciding which university is the best fit for you. So today we hope to help you understand what career may be a good fit, and which questions you should be asking before choosing a university. When you are just starting out, the various career choices within the health sciences can seem overwhelming, and it is not easy to know what to look for or what questions to ask. So that is what this webinar is for, to help you ask the right questions of your future academic program. So I want to talk first about the location of the university. Location is so important when choosing a university because it is your firsthand experiences and internships and research, not just your academic coursework, which will strengthen your resolve to earn a degree in healthcare. It can be a long journey. The Longwood medical area in particular, where the university is located, is the preeminent destination for the world's best scientists and healthcare practitioners. Along with Cambridge, which is just across the river in the back left there, Boston is the US hub of healthcare education and innovation. Some of the world's best hospitals and research labs are located within either walking distance or a short train ride. Every year, MCPHS receives many applications for students who want to pursue careers in medicine and dentistry. However, the clinical side of these pursuits, which means treating patients, is really only the tip of the iceberg. It's what you may know and understand and be thinking about right now, but really there's much more happening below the surface. What I really value about MCPHS is the faculty's willingness to assist students in their exploration. This includes areas like research and disease prevention, healthcare business and technology, biomedical sciences, and biotechnology. This comprehensive training will make you a much stronger applicant to medical or dental school. This is from a research report last year that listed the top 25 life sciences research talent clusters. And you can see here that in the United States, Boston and Cambridge does rank #1. We have the most and the highest quality researchers and scientists in the United States. And this is why many students want to come to Boston to study.
Great, thank you, Paul. So we have some special guests that have joined to give you some more information about this next journey. We have Dr. Alex Trayford, who is the Assistant Dean of the Massachusetts College of Pharmacy and Health Sciences School of Arts and Sciences. And we also have Alyssa Forbes, who is the Assistant Director of Student Engagement at St. George's University Medical School. We're going to hear from Alyssa in just a moment, but first we're going to hear from Dr. Trayford. Unfortunately, he did have a scheduling conflict for this webinar, but he did take the time to record a video. It's kind of a Q&A format, but I think there's going to be a lot of super helpful information about how we can support you as a future student. So Paul?
My name is Alex Trayford, and I am one of the academic deans in the School of Arts and Sciences. I'm also the Director of Health Professions Advising, which means that I'm the point of contact for any students who are interested in medical school, dental school, veterinary school, optometry school. And I'm also an archaeologist, and I teach courses in the social sciences and archaeology. It kind of really starts with the faculty. We really have an open door policy. And one of the major components of being prepared for medical or dental school is know your faculty well. Everyone needs recommendations, and that's really the place to begin, and show interest in your studies. Second thing is you can't beat our location. You know, we're unique in that we share a street with some of the best medical and research facilities in the world, not to mention having Harvard Medical School right across the street, which really opens the opportunity for medical-based research, collaborations. And so I think that really kind of sets us apart. The combination of the academics with the practical, I think, are really important. And as we've seen, you know, students excel once they understand the importance of those components. So that question can be thought of in a few different ways. Any given year, I could have as few as 10, as many as 40. The reason for that is the student and I have to make the decision whether that student is competitive as an applicant. Oftentimes students will come to university feeling as though my goal is to, what they'd say, go right on after my undergrad. That means applying as a junior, and in most cases a 21-year-old. And that's no longer the norm. I think a lot of students feel it's the norm, but the average age right now for medical school is about 24. And a lot of that has to do with people changing careers that have been in healthcare for quite a while. So they're already coming in with a vast amount of experiences, which is going to be appealing to a medical school. So we have to determine what is competitive and do you fit that competitive profile? And so that has a lot to do with when a student decides to apply, and that has a lot to do with the numbers. The other layer would be status, citizenship status. And there's a vast difference between American citizens and permanent residents, Canadians and international students. The main difference has to do with funding. So it's much more difficult for an international student to be accepted into an American medical school for a couple different reasons. First, the 150 plus medical schools, only 50 will even entertain a application from an international student. So from that point of view, less than a third will even look at an applicant. The other piece is the international student faces an uphill battle with funding. You cannot access funding from the US, and the alternative to that is having to have the money set aside and proving that you have 4 years, 2 years to 4 years of funding already in an account. And that's difficult. And what we see is a lot of students will look at the numbers and say, well, overall, there's been about 9% of international students that get accepted to medical schools. If you look at the data from 2019, which was the year before COVID, 0.6% actually began, and that's less than 1%. And the reason for that, much of the reason is financial, because the lack of availability of loans. And so it's very restricted. And that information actually gets published every year. And there's an online document that any student can look at and view the numbers and get a sense of what schools will not only accept an application, but also the amount of funding that would be available or not to them. So it's difficult. Dental school is a lot easier, actually, and we're very successful getting dental applicants in. And there's just very different reasons for it. Dental schools are not supported by the state like medical schools are. And so they're far more open to accepting international students. There are some that seem to particularly like our students, international students. New York University, one of the best dental schools, has over the last 3 years taken 4 of our international students, which is great. But students also get into the University of Southern California, interviewing at Columbia and a variety of other places. So it's a very different situation for potential international students interested in dental school. Well, I would say it's not true, because we know that a percentage of students who are international apply every year to medical schools. Some of them get accepted, and so I would say it's not true that they don't get in. I would say it's a difficult process, and the expectations are that, and if you think about it, only 40%, 44% of American students get into medical school at any given time. So the process in and of itself is competitive. Obviously, for an international student, that gets upped, a pretty big percentage. But it doesn't mean that a student who is committed to trying shouldn't try. It just means that if you look at the profile of what an international student really has to be, you really have to stand out even more than an American student would. And that means very, very high grades, very, very high standardized test MCAT score. That also means that the experiences you have to make you stand out. I say to all my students who are interested in medical school that the application and the competitiveness is just to get you an interview. It's not to get you into medical school. You don't get into medical school unless they've decided they want to meet you. And the goal, and how I consider my role, is to get a student to an interview. And that's really the difficult part, because they have to be able to take your application out of a stack of thousands and decide, we really must meet this person. And that's how I view my role, is to do whatever I can to get a student to that interview stage. But again, it takes a lot to be able to have your application pulled out of many thousands. But it's certainly doable, and it happens all the time. Yeah, when it comes to grades and MCAT score, each school has a way that they define the type of student they're looking for. You'll have the medical schools who are the top 20 in the country, and they're accepting 3.8s, 3.9s, and 4.0s because they can only. The MCATs reflect that. The MCAT scores are at the very high, percentage of an overall score. So it really depends on the school. And so the range is, I could say that what I would look for to be competitive, would I had to pick some numbers, which I do for students who ask that question, I would say the expectation would be a 3.5 minimum. And then an MCAT score probably in the 80th percentile. That at least gets them into, competition. An international student, though, my expectation would be much higher. And again, it has to do with the level of competition, and it's standing out more. They have to take, not only are they looking for the competitive candidate, but they're also have to look at international students a little differently as far as the profile, because of some of the things we've talked about. So I would say that to put a number on it would be difficult. It's easier to say it has to be high, but that's going to be determined by the school itself. A Stanford or a Harvard is going to have much higher expectations of scores as a Tufts even, which is a wonderful medical school. But there's still a difference in the profile for those types of schools in general. When I talk about the numbers, which I know students ask a lot of, I've heard so much over the years, tell me what my GPA has to be. And part of that is, it does have to be at a certain level. But what stands out and what makes a medical school look at another person and want to really interview them is, all things considered across the board, if they have groups of students, thousands of students with the GPA they're looking for, the MCAT score they're looking for, now everyone's even. What comes next is, well, what have you done? What have you done since you made the decision to go into healthcare? Since you made the decision you wanted to go into medicine, what did you do about it? And that's where you need these other things to make you stand out. It also shows commitment. Part of that process is understanding what it means to work around people who are not well. How do you go about caring for someone who needs caring for? And are you good at it? Are you comfortable with it? So part of what really goes into it is an understanding of what an individual needs at any given point. What does it mean to be a caregiver? That's the most important part. There are ways to do that. The American Association of Medical Colleges, point out a few things. One of them is, volunteering at a hospice. They point that out. One of the other things is any sort of patient contact. That could be volunteering in a hospital that has you greeting patients, that has you, putting you in a venue that allows you to have a conversation. So that's actually really important, because we're trying to create doctors that are humanists, that can talk to other people and are comfortable doing it. Besides that, research can go a long way. It's no longer a deal breaker if you don't have it. But if you do, and it's connected to an area of interest you have, international students with an F1 visa, they have what's called curricular practical training, that they have options that they can do something in a lab, and we would give you academic credit for it and allow you to have those really important experiences. So what I usually will ask a student is, what are your interests in medicine? And how do we tailor the various components of your activities and experiences to reflect that? And that could mean, again, it could be research, volunteer work, community service work, patient contact. It all kind of comes together. And to be able to show that you're committed to working with a certain type of patient or on a certain medical condition, the more you'll be looked at as a serious candidate. And so that's what I spend an awful lot of time with students doing, is figuring out with them, what is it that drives you to enter medicine? And I even put it in a different way. Why must you enter medicine? Why is this the one thing you must do in a lifetime? And then we begin to create that profile. So yeah, I think there's a lot that any student can do, including international students, to set themselves apart. And there are plenty of programs. I want to mention one in particular. There's a wonderful organization called F1 Doctors. And it's international students who are currently in medical school, mentoring international students who want to go to medical school in the US. And it's a wonderful program. And it's a mentorship program that students from around the world who have made their way to the US mentor others who are trying to emulate them. And it's a great organization. And I've had international students sign up and have wonderful mentees. So I would recommend that to any international student. I think it's actually a very good option for international students. You know, we already talked about the numbers and the statistics of how many international students get into, you know, an American medical school. I think what's nice about the program we have and how successful it's been for our international students is it allows the opportunity to do your medical education in 2 different places, 2 years in Grenada, and then choose where you'll do your clinicals, either in the UK or in the United States. And the track record they have with the number of students that are finding their placements is exceptionally good. And students are able to come away with a medical degree that's recognized in the US, and therefore be able to take that degree anywhere they want and practice medicine. So, you know, and I always say that you only have to get into one medical school to be a doctor. And if that medical school is, you know, it could be anywhere in the world. We happen to have the advantage of a longstanding program with a medical school that is really tailored to international students, but also giving them the option of doing their training in the US or the UK, finishing up, and then making a determination where they want to practice. So it's an option that I think is very viable. And our students have been very successful becoming doctors through that route. So I'm glad we have it. And I think that a lot of students are glad we have it also.
Just fantastic. Thank you, Dr. Treyford. So just to summarize Dr. Treyford's points, know your faculty well. So in that case, going to a smaller university with smaller class sizes would definitely benefit you. And number 2, focus on your research, your internships, and your work experience, because his most emphatic point was become a unique medical school or dental school applicant. You really do have to stand out. Krista.
Great, thanks, Paul. I think Dr. Treyford really transitioned nicely into our next speaker. Alyssa Forbes is the Assistant Director of Student Engagement at St. George's University Medical School. Welcome, Alyssa. If you would, just give an introduction to yourself. Please give us an overview of St. George's as a university, and of course, if you could highlight the Pathway program as well.
Course. Thanks, Krista. Thank you all so much for having me. As you said, my name is Alyssa Forbes. I'm the Assistant Director of Student Engagement for St. George's University. So I work directly with our Pathway programs, and I work with students from when they enter the Pathway all the way through when they matriculate at SGU. So for those of you who may be unfamiliar with St. George's University, we're located on the beautiful island of Grenada in the West Indies. We were founded in 1976, and since then we've graduated 22,000 physicians. We've had a successful partnership with MCPHS for many years through our 3+4 accelerated pathway to medicine program. So you're able to do 3 years of undergrad at MCPHS and then come to SGU for 4 years of medical school with us. The application process is very simple, and you can connect with Krista to learn more about it, and they're able to walk you right through the process, and then you work with me alongside. And the requirements for the pathway are also very simple to meet. So it's a 3.4 overall GPA, and the MCAT is actually optional for international students, only required for US citizens and permanent residents. And just a little bit more about SGU. As an international medical school, we're one of the most diverse. 25% of our students are international, representing 48 countries around the world. Right now, we have 1,255 students who are non-US citizens or permanent residents. So we are designed for international students and to assist international students along the way. We have over 50 years of educating students, and we have visa and immigration support, English language support, support transitioning, pathway support, all while providing the most relevant and up-to-date information to students as well.
That's great. Thank you so much, Alyssa, for such a great overview. So we as an institution formed our articulated agreement with St. George's University Medical School back in 2016. And the primary focus was to ensure that we had an option for our international students to have a vision to get to medical school in the future. And so we've done all of the hard work with St. George's already to make sure that the curriculum and the sort of foundation that you'll have with us is a great stepping stone to the 4 years of university, or sorry, 4 years of medical school at St. George's. The partnership is very strong. We have quite a number of students that move into the pathway each year. Students can apply during their high school year. We also will accept transfer students into the pathway. One of the things I like about the pathway is it's non-binding, so you can certainly change your mind. If you decided you'd wanted to look at other medical schools, or maybe, you'd like to finish your 4th year of your degree with us and then go off to medical school, you've got options. We've built in the flexibilities so that you can, explore whatever opportunities are out there for you. But our partner, St. George's, is there once you are admitted into the conditional admission pathway. So with that, I would like to introduce Kurbanaly, who is a current student at MCPHS. I worked with him very closely just 2 years ago when he was in the shoes of most of you in looking at your next steps for an application. So Kurbanaly, if you could walk us through 2 years ago, 3 years ago, when you were considering study in the United States. What was it about MCPHS, maybe the pathway, that really drew you to take the next steps to apply?
Hello, everyone. I'm Kurbanali, as it mentioned. And before answering that question, I want to kind of bring this, what was my personal interest and how I chose to come to MCPHS University. For people to know, I'm a 2nd year medical and molecular biology student here at MCPHS University, and I'm really passionate about understanding how brain disease work at the smallest level, so we can develop more targeted treatment. So Paul already mentioned about our location, and I actually cannot stop to stress more about it, because our university, it's very close to Howard Medical School and Boston Children's Hospital, which is I'm currently doing my internship in. And when I was considering for applying to which university, and it was kind of, how to explain it, it's very difficult choice, because it takes a lot of introspection and consideration of various factors about your personal interests, what you want to do in the future. And when I look at the Boston, and I of course look at my opportunities, what I can get, and I'm looking all these hospitals and the hospitals. Just a moment. I think my alarm just go off. I'm really sorry. Just a moment.
That's okay. While you turn that off, I was going to ask you actually about, success is absolutely in the classroom. Success is building a strong GPA profile in all of the foundational maths and sciences to be a successful candidate to move on to medical school. I think what's unique about you as a student is you've really taken advantage of opportunities to build your resume of experience outside of the classroom. So if you could talk about that just a little bit more.
Yeah, exactly. So as we already know, like the university being in the center of Boston, and going and seeking the opportunities is all around the corner. For example, the Boston Children's Hospital right now, I'm doing in a neurosurgery department, sharing the floor with one of the best doctors, best physicians, best neurosurgeons in the world, which is, I cannot imagine to do this anywhere in the world or even in the United States. And secondly, I also got an opportunity. The best thing about the MCPHS University is being close to other universities too. So like you can get the advantage of other universities, for example, Howard Medical School. In my case, I also got advantage of Boston College, which I also studied for emergency medical technician. And something that I also personally, I kind of think that for every single pre-med or bio student, it could be as important is volunteering the opportunities. For example, Mass General Hospital, one of the biggest hospitals in Massachusetts and or in entire United States. And I got to do also volunteering there and understanding this first-hand experience, being in the hospital and see the patients, talking with patients with firsthand. And finally, I also want to talk about how I choose to apply for St. George's University when I came here in the first year. And everyone is we're talking about St. George's University because it's not a secret. It's very difficult to get into any medical school, right? It's difficult and it takes a lot of high GPA. As an international student, as it's already mentioned, we have roughly 30% of the universities we can apply. And it was like stress build up on the top of a lot of classes I had. I was like, what I'm gonna do after 4 years? What if I don't get into medical school? What I'm gonna say to my parents? How it works, right? How it's like when you are 18, 19, you're thinking about. And my friends told me about St. George's University. So he told me that you study 3 years here and then you go to the Caribbean. You study 2 years. If you want, you can go to the United Kingdom afterwards to do your residency, or to Canada, or in the United States in the big cities. So it was, I'm gonna say that kind of challenging to start the application because you have always like a doubt, the decision of doubt. But I took the decision and contacted Alyssa Forbes, which is already here. And I expressed my interest about applying to the medical school. And honestly, like just submitting that email, everything started going so flawlessly, because after 2 weeks, I was able to send all my documents. In another 2 weeks, I got my interview with St. George's University. So about maximum 1 to 1.5 months, I got my email saying that Kurban Ali Kurbanov, you have been selected for studying Doctor of Medicine, MD, at St. George's University. And this was one of my happiest days because right now I don't have to think about when, like what I'm gonna do after 2-3 years. Not only I'm gonna finish, medical school is securely, but also I'm gonna finish it earlier, because usually medical schools, if everything goes perfectly, they're gonna finish it in 8 years. With St. George's University, you are able to finish it in only 7 years, which is really fascinating. And yeah, that's my experience at MCPHS University here.
That's wonderful. I think we all can feel the excitement coming out of your voice, talking about your experiences, talking about your journey so far. You have a big journey ahead, and we're really excited to be able to witness your next steps. So thank you. Thank you for that.
Thanks so much.
We're just a little over halfway through the webinar, and I just wanted to remind everyone who's joining us, if you do have questions, please use the Q&A box to share your questions. We will have time at the end of the presentation, and we'll ensure that we try to get to every question. So Paul, I'll turn it back to you.
Thanks so much, and thank you, Kurbani. That was just so much passion coming from you. I'm so energized. I want to go apply to medical school now. So let's move on and talk a little bit more about dentistry. Hyojun Lee is with us. He is starting at NYU College of Dentistry this coming fall. His journey at MCPHS began with the intention, actually, of pursuing the Doctor of Pharmacy degree. However, his path kind of took a little bit of a turn when he discovered an interest in dentistry, leading him to transition to the pre-dental dental hygiene program. Throughout his time at MCPHS, he found the clinical experience to be particularly enriching, providing him with the opportunity to actually apply his knowledge directly to patients, which is unique at the bachelor's level. In addition to his coursework, he actively sought out opportunities to become a strong dental school applicant, such as participating in volunteer initiatives like Give Kids a Smile Day, where he collaborated with Harvard Dental School students to provide dental care to children in the community. And his goal is to specialize in general dentistry, leveraging his skills and passion to deliver comprehensive care and make meaningful impact on the oral health of his patients and community, which is very admirable. Hyojun, thank you so much for joining us. What should prospective students know about the American dental education system that was not immediately obvious to you when you were applying to universities?
I think that I think the dental admission test was one of the things that probably most dental school applicant would think about and would have a hard time like getting good grades on it. And I think the MCPHS did a lot of good job um, getting a good grades on DAT. I think we have really good professors helping to learn the materials that are related to DATs, such as like general chemistry and general biology, and even organic chemistry mostly. And all I did was just look at all the slides that was given to me during those class, and I just study those and get a little bit more supplemental materials from other websites. But most of them, I spend most of the time studying that, and that helped me really getting a good grades on it.
Yeah, so NYU Dentistry, as Dr. Trayford mentioned, is one of the most competitive and one of the best dental schools in the United States. So your DAT score, dental aptitude test, must have been extremely high. So I assume that you really developed a really strong foundation in biology, chemistry, mathematics, and were able to apply that at the time when you really needed to, which was preparing for and taking that exam. Is that correct?
Mhm.
Cool. So what other factors do you think are important for students to consider when evaluating universities?
Um, I think it varies, depends on which dental school you apply, but mostly the general like scheme is basically the same, like having a good GPA, having a good DAT score. But as like Dr. Treffer mentioned, um, as soon as you get into interview, you have to stand out, and you have to have unique things you have done, like volunteer or work experience and stuff like that. So what I would like to say is that I think the volunteer is most uh, um, I think it's really easy to access, and there's a lot of good opportunities you could do that is not even related dental related, but also dental related. Um, and you can seek out those opportunities from our schools or by yourself. And and in terms of like work experience, it doesn't have to be like internships. You could just start off from the dental assistants and stuff like that to get a feel of what the dentistry is like. And I think that helped me a lot. And yeah.
Yeah, that's a great point because it's actually very rare for first year dental students to have any experience working inside a patient's mouth. And you, as a dental hygiene pre-dental student, have a lot of time working inside patients' mouths. That was part of your degree. It was part of your training. And it really is unique. MCPHS is one of the only universities in the United States that provides this type of experience as part of a pre-dental track. Great.
That's correct.
All right, let's go on to Zheyuan Li. He is a fourth year international student majoring in medical and molecular biology and minoring in gerontology. He was accepted into the American College of Cardiology's Young Scholars program in 2022. This program aims to provide promising young students with an introduction to the field of cardiology. He is currently working on a project with one of his professors about biomarkers of cardiovascular diseases. He's also working in a lab that's researching ascending thoracic aortic aneurysms. I practiced that a few times. After graduating from MCPHS, he plans to work in clinical research related to cardiology and ultimately become a physician scientist in the field of cardiology. Ziyuan, thank you so much for joining us. I really appreciate it. Your experience so far at MCPHS is really impressive. I can safely assume that you were admitted to a wide variety of very good universities. Can you tell us why you chose MCPHS and how it's gone so far?
Thank you, Paul, and thank you so much for having me as a panelist member. There are two main reasons why I chose MCPHS as my undergraduate school. The first one is because of the location, as you and our previous panelist members mentioned. I actually visited Boston in fall 2019 for a competition during high school. And that is actually the first time that I visited Boston as the city, and also I had a chance to visit our Longwood medical area and also our school. And I found out the location of our school is just amazing. There's different hospitals around our school that can help actually let students to explore their interest in different fields and kind of find their interest in different fields. And the second reason is because of the major. I am currently a medical and molecular bio major, and I am previously a pre-med health sciences major. The course settings actually prepares me for medical school, and also in terms of the bio major, it kind of helps me explore my interest in bio, and also there's some of the lab courses that can actually helps me learn more biotechniques, which will be super useful for me in the future. Yeah.
That's really good. Is there anything that you wish you had known back when you were applying to universities as a senior? Anything that kind of that you've learned over the past 4 years that maybe you wish you had known back then?
I would say trying to engage more in classes, and also frequently visit professor's office or high school teachers' offices. Not only for a good recommendation letter, but also those our professors and also teachers can, if they get to know me, they can provide more useful advice to me in the future. And then me being an introverted person is like being so shy to and also hesitated to visit my high school teacher's office. And then I was like, wow, this cannot happen in college anymore. So when I entered college, I started to visit professors' office hours and kind of introduce myself, and also letting them to know me so that they can kind of help me or offer me advice or suggestions in terms of undergrad education or probably other future plans. Yeah.
Yeah, and it's such a good point. It's not just about the letter of recommendation, right? That is so important, but even more important than that is mentorship, direction, uh, uh, asking the right questions. So, you know, our faculty members are great at helping students find their path through asking questions and opening doors. That's what they're really good at. Speaking of that, I know you've worked closely with Dr. Trayford. How has Dean Trayford helped you kind of in your journey?
When I was in my freshman year, which was back in like 2020, at the beginning of the pandemic, I was fully online back in my home country. And during my very first semester at MCP, I started to know Dean Trayford and kind of started to schedule meetings with him, and also asking about how am I going to plan this 4 year of undergraduate education, and in order to achieve my goal in becoming a physician scientist. And then he offered me like advices like for the first year, that what you should do, and kind of focusing on the different courses that you're taking, and on the second year you should start to kind of looking for research or things like that. It's kind of very helpful. And when I speaking about like my Young Scholars Program for the American College of Cardiology, when I first found this program, I actually talked to Dean Trayford about this program since I have an interest in cardiology. And he's like, yeah, this is definitely a program that you wanted to apply to. And he actually helped me with advices for the personal statement. And he also provided my letter of recommendation, and special thanks to Dean Trayford. Yeah.
That's
And
great.
as for during my fourth year, currently, as I'm planning to apply to medical school and also other research positions and also clinical research coordinator positions, he also offered me advice such as like trying to talk to my PI about and ask for trying to engage with more people so that I can have suggestions from different people. And in terms of medical school application, I'm currently working on my personal statement, and probably will talk to him very soon. Yeah.
I think you're going to make a great doctor. And don't tell yourself that you're introverted. I don't think you are. It seemed like you're very willing to open up to us. So thank you so much. It was really, really insightful. So we're going to go on to Brian. Brian is a current second-year dental student at Western University of Health Sciences, which is in California, I believe. He embarked on his dental journey at MCPHS, where he majored in the pre-dental dental hygiene program as well. MCPHS is renowned for what's called the Forsyth dental hygiene program, which he knew about and prompted Brian to enroll in 2017. He completed all of his prerequisites for dental school within just 2 years. Among his courses, dental anatomy and physiology stood out as his favorite, providing a comprehensive overview and strong groundwork essential for his ongoing success in dental education. With a robust, a great GPA, tutoring roles at MCPHS, and a year's experience as a dental hygienist, Brian emerged as a very strong candidate for dental school. His future aspirations are pretty clear: to serve as a general dentist, committed to delivering high-quality dental care. Furthermore, he also envisions a role, I hope people are listening, where he can give back to MCPHS, aspiring to join the dental hygiene clinic as a part-time clinical faculty member and leveraging his expertise to benefit future students. I hope people are listening, Brian. Thank you so much for joining us. What do you wish, again, same question, what do you wish you had known when you were applying to universities as a senior? Would you do anything different?
Yeah, thank you, Paul, and thank you for having me today here. And I think my situation is kind of different than the previous students. Before I went to MCP, and I've already had like a few gap years in between high school and college. And you guys know I'm an international student, so I'm realistic. And during that time, and I was considering about how to increase the chance to get accepted by dental school first. And the second one, if I did not get accepted by dental school, I was thinking about there any other opportunity to get a job still in the dental field. So that is the two main reasons I was thinking about during that time.
Okay, that's interesting. The Forsyth Dental Hygiene Clinic is very unique for MCPHS. Can you tell the audience more about it? What does it look like? What do people do there? And how do you think it was instrumental in your journey towards dental school?
Well, I think Forsyth is a very famous in the Boston area, and we have a very good faculties, especially teach us very solid hands-on skills and for the scaling. And literally in my year right now, and a lot of dental students around me, and they just like kind of go to reach out to me and let me to teach them how to do the scaling because I got my dental hygiene license before. I think it's a pretty much worthwhile when you get accepted by the pre-dental dental hygiene program in MCP. And our clinic, in my memory, we are a very big family. Everybody is a pretty passionate. Every faculty is really they're very amazing, and they are gonna give you any tips if you want to know. They never ever like hide their skills to you. So I think it's a pretty much fun time during the time I was at my professional years in MCP. Yeah.
So it sounds like you were very well prepared for professional dental education because of your time at MCPHS. Is that correct?
Right.
That's awesome. Anything else you'd like to share, Brian? Anything else that is top of mind?
Literally, I was thinking, I was just want to say like a free dental and dental hygiene program is awesome. You guys can try to think about it. It's give you kind of like the different chances, and not only get accepted by dental school, but also you earn your dental hygiene license. Even though you did not get accepted, you still can learn and get the experience working in the dental field. It's pretty much worthwhile. Yeah.
Yep. I agree. All right. Thank you so much, Brian. So the theme that is emerging from all these stories is that your experience outside the classroom is just so important. What you develop as an interest, what projects you do, and how you become motivated to do 3, 4, 5 more years of additional study. This is just a list of some internships that students have done recently at MCPHS. You can see a wide variety of different subjects and disciplines and locations all throughout Massachusetts, and even outside of the state of Massachusetts as well. MCPHS really does have an impressive history of student outcomes, with alumni working in all areas of health sciences. That includes healthcare practice, technology, business administration, and biotechnology. This student in particular, I worked very closely with. He's doing 2 years at Vertex Pharmaceuticals as a research scientist, and his plan is to go to medical school. So he's going to get 2 years of experience in a leadership role doing very important research to develop new therapeutics, and then using that knowledge to apply to medical school and hopefully be a clinical practitioner. This is a student working at a biotechnology company, another biotechnology company. And this student here is from South Africa. He's working at the Joslin Diabetes Center, which is not too far from MCPHS's main campus in Boston. We have students who are working for some of the biggest pharmaceutical companies in the world: Novartis, Brigham and Women's Hospital, the Dana-Farber Cancer Institute. A clinical research coordinator is typically somebody who is looking into new therapies, in this case for cancer. And then more pharmaceutical companies. So you can see our students do quite impressive things, and we're really proud of that. Let's move on very quickly to talk about STEM programs. This is really important, especially for international students. Certain programs at MCPHS are STEM eligible, meaning that you are permitted to work in the United States for up to 3 years after completing your degree. So this is really important in the context of medical and dental education because as we've highlighted, getting experience during and after your bachelor's degree will help you become that really unique and differentiated applicant. So the programs that are STEM eligible at MCPHS include medical and molecular biology, chemistry, biotechnology, health information management and technology, data science and biotechnology research, data science and health analytics, pharmacology and toxicology, and then a program called Pharmacy and Life Sciences, which is a degree granted to PharmD students after their 4th year. So these are the bachelor's programs that are STEM eligible. This is really important to keep in mind when you're applying to universities because you really want to be thinking down the road. You want to have the option of working after you graduate. Even if your plan right now is to go directly into a medical or dental school, you always want to have that option to get additional experience. So really, it's about asking the right questions of your university. On average, students apply to 10, 15 universities. What are the right questions to be asking? So we hope this discussion was really helpful. Remember, we want you to ask some questions. So if you do have questions, put it in the Q&A. We're here to help you. If you need help, we'll put our email address in the Q&A as well. But for now, let's stop and see if there are any questions with just the 2 minutes we have left. Any questions? I didn't see any in the Q&A. No?
I think we're good. We must have done a great job because, oh, it looks like one just popped up. Can you talk about the admission requirements for Canadian citizens who apply from high school? So yeah, I am your contact, Nia, for that. I would love to talk to you further. I definitely work very closely with our Canadian applicants, and we can talk about all of the admission requirements, including science coursework, math coursework throughout high school. We don't require the SAT or the ACT. I get that question a lot from our international students. We are test optional in that sense. So we'd love to talk to you more about the next steps to apply. So please reach out.
Any other questions? We do have we can stay on another minute or two if there are any. You're welcome to scan this QR code. It'll take you to our application page if you have not applied yet. Otherwise, reach out to us and we'll help you with your application.
Well, great. Well, thanks so much for everyone who took the time to join the webinar. If you're watching this on recording, please reach out to us. We'd love to set up a one-on-one interview, a one-on-one meeting to talk about all of your next steps. Thank you very much to our panelists who took the time to be on the call. I think we've had a very diverse group sharing their perspectives on how MCPHS can be extremely supportive to you in your journey, whatever your next steps might be for a career in healthcare. We're here to support you. So thank you very much.
Thank you to the panelists. Thank you for the attendees. Thank you, Krista. Thank you, Lauren, for organizing everything. Have a good night, everyone.